Doctors and nurses, what's the most obvious case of a patient faking it you've ever seen? Paramedic here. Gentleman called 911 from a restaurant claiming he had a migraine and was unable to see properly. He was literally 2 blocks from the hospital. I've had migraines. I'm sympathetic. On the way to the call, I was planning my treatment plan so he would be more comfortable during the wait in the emerge. He was waiting outside, in full sunlight, waving at us, thanked us politely for coming to his rescue, sat in the well-lit ambulance, chatting up a storm, making inappropriate jokes, and laughing, stating the whole time he has 10 out of 10 pain from a migraine, and that only Percocet works to reduce the pain. He has them frequently, and wouldn't you know it, he's run out of his prescribed medication, and his doctor is on vacation. The chef from the restaurant he called from came out and asked for his information. Our patient was unable to pay his bill due to the pain. He conveniently had no ID he could leave at the restaurant and only had his debit card with him. He promised to come back once he was feeling well enough to tap his PIN into the machine, but right now he couldn't. The chef knew 100% the guy was full of crap, but couldn't do anything. As someone who's had a vomiting, shaking, vision-affecting migraine in the past, he did nothing to convince anyone he was in actual discomfort. I actually would greatly prefer if he had said, "I ate a meal I can't afford and I'm addicted to painkillers. Can you please take me to the ER?" Honesty would have gotten him better treatment from everyone involved. Edit. We took him to the ER. He waited in the loud, busy waiting room reading magazines. I'm from Canada, so his ambulance bill is mostly paid by the Ministry of Health. Physicians can sign a patient as non-essential, which would cause the patient to be charged for the whole cost. The MOH has no guidelines surrounding what's essential and what isn't, so the MD/hospital opens themselves up to a lawsuit if someone decides to sue because the MD signed their ambulance trip as non-essential. So this rarely happens. Add to that, if the patient is receiving social services from the government or has no fixed address, they're charged nothing at all. The studies have been done. Paramedics/EMTs in other countries can tell you, charging people does not reduce the frequency of illegitimate 911 use. And so a lot to unpack on this one. I just wanted to say, as a migraine getter myself, is that a word? Those of you with migraines understand, like a 10 out of 10 pain means like literally if you had a gun in your hand, you might pull the trigger. That's how bad it hurts. A 5 out of 10 is crippling. A 2 out of 10, you don't even want to open your eyes. So yeah, 10 out of 10, not buying it. That's tough. Next story. I'm an audiologist. It's fairly common to have people fake hearing loss. With adults, it's commonly for workers' compensation and benefits. Children do it for attention or to get out of school for a day. They're fairly easy to spot. Patients will come in conversing with me very normally, but the audiogram will show a profound hearing loss. We have our tricks to get them to slip. I like to lower my mic volume to a normal range and mention that they drop something when they're in the booth. They instinctively reach for it, forgetting that they shouldn't have heard it because of their loss. We can also do an auditory brainstem response, bypassing the need for patient responses. A Stenger test can identify those fakers that only have a hearing loss in one ear. My favorite is when testing kids that are clearly faking. Part of the test requires me to have them repeat words. So I present them at a normal volume, and the kids are really straining to hear them. Then I slip in funny words like butt crack and watch them smile because they clearly heard it. TLDR, don't fake your hearing test. It's super easy to catch you. Next story. Paramedic here. I have 3 stories that come to mind. Story number 1. We got called to a local Waffle House for a seizure. We walk in to find a man lying on the floor, not moving, but breathing. We start talking to the waitress, asking what had happened. While talking to her, we occasionally look down at the patient and find him with one eye barely cracked open, watching us. When he sees us looking at him, he closes his eye. This happens a few times. Then the cops show up and find out what's going on. One of the officers asks the waitress, "Did he, the patient, eat here?" "Yes, he did." "How much is his bill?" $14. At this point, the officers roll the patient over and find his wallet. The guy has a $20 bill in it. One of the officers takes out the $20, waves it to the waitress, and tells her, "Keep the change." You could see the anger in the patient's face when he realizes he's not getting out of paying his bill. He ended up faking a seizure on the way to the hospital. I'm not about to explain how I know it was fake, because I'm not going to give anyone any info on how to fake a seizure. Story number 2. We got called to a fall in the woman's bathroom at Walmart. We walk in and the manager is freaking out. We go into the bathroom to find a white female face up on the floor. I'm guessing she weighs at least 350 pounds. There were 2 friends of hers standing in there with her. I ask her what happened, and she says she slipped on a puddle and fell, hurting her back. I look all over the bathroom floor. There's no water on the floor. I asked the manager and the patient's friends, "Did you see water on the floor?" They all said no. I then tell the patient, "There's no water on the floor, ma'am," and she says, "I'm lying on top of it. We're going to have to roll her to her side in order to get a backboard under her to pick her up." I explain that to her. As we roll her to her side, I check her back for any obvious injuries. I then check her clothing and the floor she was lying on, and nothing was wet. I have the manager, who was grinning from ear to ear at this point, and the patient's friends look. "Do you see water on the floor? Are her clothes wet?" They all said no. Then we roll the patient onto the board, pick her up, and place her on a stretcher. At this point, I tell the patient, "I'm going to be writing up paperwork for this call and your treatment. Part of what's going to be written up is the fact that you said you slipped on a wet floor, and that no water was found either on the floor or soaked into your clothing. This is standard. I have to write up what I'm told in addition to what I see. What you need to understand is this. If you happen to decide to take Walmart to court, they can request a copy of my run report, and it's going to show what you said and what I found. They can also summon me to testify, and if they do, I'm going to tell them what you told me and what I saw, the manager saw, and what your friend saw. That being said, do you want to keep dragging this out and go to the hospital, or do you want to just get up from my stretcher and be done with it?" She chose to get up and leave. Story number 3. We get called to a 13-year-old having a first-time seizure. We get on scene, and the entire family is freaking out, except for the father. I walk into the room where the kid was. Obvious faker. I turn to Dad and have him go outside into the hallway. I tell him the boy is faking, and I ask if anything unusual happened today. The father tells me he found marijuana in the kid's room, and he was getting on to him about it when the kid started seizing. I reassured the father that his son was not seizing, and he asked if we could take him to the hospital just to be safe. I said no problem. We pick the kid up and put him on the stretcher, and as we head outside to the ambulance, he exhibits more behavior that shows he's faking. Inside the ambulance, I tell the kid that I know he's faking and ask him to stop, but he keeps on. The hospital we take him to doesn't have board-certified emergency department physicians. They use general practice and internal medicine physicians. A lot of smaller hospitals do this. I bring the kid in and give a patient report to the internal medicine doc and the RN, and I say the kid is faking his seizure activity. The doctor had a problem with that. "You can't possibly tell that he's faking." I assure him that yes, the kid is faking. I explain the situation that led up to him faking and that I could prove it. The doctor says, "I'd like to see that." The RN knows exactly what's going on and what I wanted to do. He's all for it. So I say to the kid, "Bob," I don't remember his name, "we need a urine sample from you, and we need you to wake up to do it. If you don't wake up, we're going to shove a tube into your chicken, run it all the way into your bladder, and take a urine sample from you. Please, wake up and give us a sample." Nothing from the kid. "Okay, Bob, if you don't wake up in 10 seconds, we're going to start prepping you to get the tube shoved into your chicken. 10, 9, 8, 5, 4, 3, 2, 1. His eyes opened wide as saucers before he realized we caught him. He then closed his eyes, started blinking, looked around the room, and said, "What happened?" The RN was laughing, and the doc was a little pissed. Next story. My partner at work is an administrator with an ED nursing background. She was called into the ED one night last year to deal with a patient who was complaining of severe headaches and nosebleeds, but was refusing to go for any kind of examination in favor of being admitted. They're pretty sure at this point that she's drug-seeking, as she refused to even lie in the bed. My friend left the room and was standing a few feet outside the patient's glass bay talking with the charge nurse when she noticed the patient turn around and hunch over. She subtly stopped the conversation so they could observe. The patient turned around with more blood on her nose and blood on her fingers from where she had been reaching into her underwear and smearing blood all over her face to fake a nosebleed. This is pretty gross. I feel like there's other ways to fake a nosebleed than to get blood from that source. The lengths that some of these people go to. Wild. Next story. Ooh, that's a toughie. It's either 12 or 13-year-old kid was having seizures, would have another every time the ER tried to discharge her, magically woke up when her father proposed getting ice cream with no recollection of what happened. Video EEG was negative, of course. Old lady pretending to be catatonic was helping us transfer her from wheelchair to bed, i.e. was not limp, and when we had her hand over face and let go, she dropped it to her side. If she were truly out, it would have smacked her. A lot of pain fakers are obvious too, but pain is a bit more of a gray area, while the above have objective findings. Next story. My sister-in-law used to have seizures. She got in a minor car accident once, and afterwards in the hospital, the doctor told her she may have had a mild seizure during the accident. This was 13 years ago, so I can't remember the details about the wreck. My brother was worried about leaving her and their son alone, so she was staying at my parents' house while he was at work. Suddenly, she was having regular seizures, but only when she had an audience. I only witnessed one of them, but it was ridiculous. It was the day before Thanksgiving, and my whole family was at my parents' house. Me, my sister, and other brother and our spouses. We're all talking, and she suddenly starts shaking all over, slides herself off the couch to lie on the floor, jiggles about a bit more, and then goes still and pretends to be unconscious. My dad called an ambulance, and she was still unconscious when they arrived. They started talking to her and asking her questions like, "Can you hear me?" etc. She would nod her head in answer to their questions, and I remember the EMT being like, that's weird that she's answering. She goes to the hospital again, and according to my brother, they told him she was having pseudo-seizures, which I believe was their polite way of saying, your wife is faking this for attention. There was another time shortly after that when she was at my parents' house, and one of my dad's friends came over, and while he was there, she had another seizure and rolled onto the floor. My dad had apparently had enough drama at this point, so he just walked outside with his friend. When he came back inside, she was sitting on the couch like nothing happened and never mentioned it. Next story. My husband is a firefighter and EMT, and he told me about a time where they were called for a man seizing. When they got there, a guy was lying face up on the floor, not moving, and then started faking a seizure. They stood there saying things like, "Oh wow, this is a bad one, but if they did XXX, then we should really be worried." And the patient would suddenly start doing XXX behavior. Apparently this went on for a while until he miraculously woke up in the ambulance asking for opiates. Next story. Happens every day. A lot of patients in the hospital are in pain, and many for a good reason. We tend to treat them with varying strengths of narcotics. Not uncommonly, people like to take advantage of that. Numerous times, I'll ask someone to rate their pain with 10 out of 10 being the worst they've ever had, and it's always 10, usually accompanied with a lot of moaning and writhing. Now I make it a habit to stand outside their door and listen and watch before I walk in. Almost always, they're chilling watching TV or on their phone, and as soon as I walk in, "Oh god, it hurts so bad, Pretty funny to watch sometimes. Next story. Husband is a urologist. ER calls with a patient who's reportedly writhing in pain from kidney stones. Patient brought with him a stone he passed for analysis. Hubby walks in, sees one of the regular drug seekers, takes a look at the samples, determines that it's a pebble guy picked up in the parking lot. Next story. As an epileptic, seeing all these stories about people faking seizures makes me incredibly angry. In fact, it's made me so angry that I've now got unspecified 10 out of 10 pain, which only Percocet will help with. Side note, to anyone considering faking a seizure, make sure to bite your tongue really, really hard. The more blood there is, the more convincing it is. Bite all the way through it if you can. And always, always piss yourself. In fact, just be sure it's probably best if you crap yourself too. Punch yourself in the face a few times or headbutt a wall to get a convincing mild concussion. And when you collapse, make sure you land directly in your piss and crap. Ideally, face first. Next story. I've heard a lot of people faking fainting are found out by simply raising their hand above their head and letting go. Magically, these people tend to move their hand out of the way to stop their face getting hit. Similarly, at a summer internship, we get a lot of patients claiming they're in terrible pain. Rolling around in pain, unable to move, notice the irony, and then 15 minutes later you see them smoking a cigarette. It drives me crazy. On the plus side, however, that internship was when I was out for a smoke break, just an excuse to get fresh air. I was given one of those electric lighters from one of them who quit right then and there when they got called out. Next story. There are some fun ones in Psych. The patient went into her room and, in a very obvious stage voice, just loud enough for us to hear her in the main area, started saying random, unconnected sentences and phrases. Then she immediately came out, walked straight up to us and said, "How do I know if the voices are real?" She would act perfectly normal when she thought we weren't looking, but as soon as we walked loudly up to her door, she'd start talking to herself again. Yeah, no, that's not how psychosis works, lol. Good try, though. Also, there is the girl who strangled herself unconscious. There was no pressure whatsoever on her throat or neck. The doctor quietly snuck up to her, then smacked his hands together in a single giant clap. She jumped. And another patient who had seizures. She lay in bed, twitching. When I called her for lunch, I said, "All right, but if you lie there for too long, you're going to be stuck with the vegetarian option." The seizures magically stopped. That is an absolutely hilarious counter to anyone faking fainting, is just give them a good jump scare and see if they react. Absolutely embarrassing, but funny. Next story. This just happened last week, strangely enough. I've been a nurse for 4 years now, and this is probably the worst I've seen it. Young adult comes in with a seizure-like activity. We're a neuroscience floor, so we get these a lot. Complains of severe abdominal pain related to her seizures, apparently. They run multiple CTs and MRIs that come back clean. We put her on a 24-hour VEEG machine, video EEG for those who don't know. She reportedly has hundreds of seizures throughout the night, with full-body convulsions, drooling, upper extremity contractions, and will not respond to verbal stimuli. She's not lethargic, just confused, doesn't know her own name, the place that she's in, or what time it is, but the rest of her neuroassessment is benign. No bladder incontinence during, had perfect control of all limbs. She screams for pain meds when she's not having seizures, but is, for some reason, refusing everything they offer her. Tylenol? Nope. Percocet? Makes her feel weird. Lidoderm patch for her abdomen. It gives her sores in her mouth. I guarantee if a doctor dropped the D word, she would have been all over that. After 24 hours of being her, thousands of dollars worth of tests being run and all coming up negative, the doctors had no choice but to send her home. She became agitated and seizing again. While the doctor's basically explaining that she's faking it, he says, "I'll wait," and she immediately stops. Security had to escort her out, with me in tow, because I was too paranoid that she would throw herself on the floor before leaving and demand to be readmitted. They recommended an outpatient psych consult for her, which made her even angrier. Lord knows, maybe the seizures felt real to her, but she didn't need a special kind of help. Next story. Well, I'm not a doctor or nurse, but I am a disability attorney. I've seen a few obvious fakes. My favorite was at this hearing office that's a single courtroom, sort of tucked onto the back of one of the satellite offices. Judges come down from the main ODAR office every so often to do hearings there. However, the entrance is around the side of the building, so people often go in the front of the building and sit there waiting, even though I told them it's around the side. So I have this client that did exactly that. She's claiming disability in part because she can't walk more than a few steps without falling over in extreme pain. Uses a cane or walker to get around everywhere. Of course, none of this is in her records. She originally claimed it was because she couldn't afford to see a doctor, so I believed her. Well, it gets close to her hearing time and she hasn't arrived. So I go out to the parking lot to give her a call. No answer. Phone already off. I figure that she went in the front entrance. Sure enough, as soon as I start heading towards the front of the building, I see her running around the side of the building, cane in one hand. She doesn't even notice me in the parking lot. I go back in to talk to her ahead of the hearing. Suddenly, she can't walk anymore. Yeah, there are a ton of cases where people can do short bursts of walking or even running, but can't do sustained standing or walking to hold down a light extortional level job. But this wasn't that. This was straight up faking it for the hearing. Now, luckily she had other mental things that were going on with her, which were actually pretty well documented, but it was still pretty funny seeing the miracle cure come running around the side of the building. Next story. I'll tell you the opposite side of many of these experiences. When I was 23, my lung collapsed. Probably the most painful thing that had happened to me aside from broken bones and such. Went to the hospital in an ambulance, and by the time I got there, I wasn't in pain anymore. I was terrified they would think I was faking it, but thankfully the chest x-ray revealed that my lung had completed its collapse, and I guess it just hurts when it's coming apart from the chest wall. I didn't have surgery, but I was on suction, attached to the wall with a tube inserted in my chest for several days. Over the Thanksgiving holiday, standard hospital, you're left alone mostly unless you ring your bell and they can come visit you. The second day I rang my bell because I was in a bit of discomfort. No one came. Rang it again and again and again. Nothing. Picked up the phone, got an outside line, called the hospital, and asked for the nurses station on my floor. Got through to them and explained my plight. Apparently my buzzer was broken. They came down so apologetic and had a new bed delivered and transferred me to it. Point is, first time I was in huge pain and then it was suddenly gone and I was in fear that they'd think I was faking it. And second time, due to mechanical failure, I got ignored. It gets better. 6 months later, that lung collapsed again. I knew what the pain from before felt like, so I was like, hey, my lung's collapsing, I think. It was midnight. My friend took me to the hospital. They took x-rays and then told me not to worry and discharged me. I was like, I'm in a lot of pain here. And they were like, nonsense, there's nothing wrong. Next morning I wake up short of breath and the phones are ringing. It's the hospital. The doctor was reviewing the previous night's x-rays, so apparently the tech nurse, or whoever looked at it, missed that my lung had in fact collapsed. So he was demanding my address so they could send an ambulance to fetch me. That time I had the surgery to staple the lung in place. No more collapses ever since. Point is, sometimes the pros are wrong. Not wrong, but they overlook things. Human error and worry about lawsuits, I guess. And we patients can be just as nervous presenting pain to doctors because we're afraid the docs will think we're faking. Next story. I have so many of these. Male patient, 18 years old, rolled in unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs when I hear something interesting. I place the stethoscope near his mouth and hear him breathe in normally, but then breathe out saying, breath. No joke. Male patient, 21 years old, admitted with inability to speak for the last 2 hours in respiratory distress. Lungs clear, but we hook him up to oxygen for a few minutes. After he's taken off, his father comes running and drags me over, saying his son's tongue refuses to go back in after receiving the oxygen. I look at the kid and he's seriously just lying there with his tongue poking out like a child. I tell him to push it back in. A few hours later, the dad tells me that the boy is convulsing. I go to see him without making my presence known, and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on his back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her and she's literally blowing spit bubbles. I check her reflexes and everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid and the spitting intensifies. Male patient, 30 years old, unconscious and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, ECG, reflexes, pupils, etc. are all normal, I start checking the pain sensation. He slowly began to open his eyes and groan as I asked him to tell me his name, but the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, complained of respiratory distress and convulsions. Everything's normal on admission, and she's conscious but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, so she was faking an illness. Since she was refusing to eat, the attending wrote up an order for a nasogastric tube, which was inserted and then removed by her in a matter of minutes. And we prescribed her sugar pills because her parents wouldn't let us transfer her to psychiatry or discharge her. She finally left after 4 days. Next story. I'm an X-ray tech. All the time in the ED, you'll have patients that come in seeking things. These patients will have a bunch of X-rays ordered, so when you first start the exams, they'll be in all sorts of pain. They cannot position any body part, fighting and begging you not to do it. Then, after about 15 minutes, when they notice you're going to do your job, they stop the charade and get through the stack of images ordered on them. It's quite incredible, really. The other thing that blows my mind is when people want the worst possible outcome of their disease. Like, you can feel the craving for sympathy emanating from them, with phrases, "Oh, that's really bad, isn't it?" Or, "Oh man, is that the worst you've seen?" Not said with dread, but barely hidden excitement. Next story. The best is when people bring their dog to the vet, claiming the dog is in excruciating pain when they're clearly drug-seeking. Funny on numerous levels. First of all, animals don't fake pain. If anything, they go out of their way to mask it. Secondly, if you're not an established client, no vet is prescribing crap without doing a complete workup, which can easily cost $300 or significantly more. And finally, most canine pain drugs are fairly mild and only prescribed in small amounts, a week's worth. So even if you get what you want, you've probably enough in the bottle for 1 or 2 good highs, if that. Edit. Some obvious exceptions. Some vets RX out Trumadol 50 to 100 tabs at a time, which could certainly be problematic. Next story. I had a surreal encounter once. My mother-in-law's a family doctor. I went to her practice to drive her home and was sitting in the waiting area. The place is emptying out and I'm there alone. The receptionist goes downstairs to get a coffee because that's the last patient and she just has to do paperwork, then they come out. Then this haggard-looking guy wheels in a wheelchair. When she's gone, he wheels over beside me. He's coughing and sounds like and looks like death. Anyway, last patient walks out before the receptionist is back. A few minutes later, out comes my mother-in-law and sees this guy. She says immediately, "Mr. Blank, please leave." He starts on some crazy mumbling ramble about how he's in so much pain and he can't even walk anymore, and a bunch of other crap, but I remember explicitly the "I cannot walk anymore" statement. So of course, she says something like, "If you do not leave, I'm going to have to call the police." And the effing guy jumps out of the chair, can't walk my ass, and runs at her. Now, it wasn't super fast by my standards, at least at the time. I was like a 25-year-old in decent shape then. but he was going to effing mess her up by what I could tell. Thankfully, I was able to get up and sort of semi-tackle him against a wall before he got to her, but Ever was strong. I couldn't actually believe what I was seeing. So anyways, Doctor's mother-in-law locked herself in the reception office that's glassed in. Apparently this kind of thing happens more than just once, which is scary. Anyways, she does that and I let my guy go, and he didn't seem like he was gonna mess with me, but I kinda think in retrospect, I probably should have kept him tackled or whatever in case he had a knife, but I thought I was invincible. Anyways, he swears at her for a while through the glass and started banging on it, and it was as if I wasn't there. I thought he might come at me or try to hit me, but no, he was just boxing the glass in front of him. The one funny part was the secretary opened the door to come in and saw the guy and spilled her coffee and ran like the devil away. The look on her face was priceless, but Lunatic Man was oblivious. Anyways, maybe like 15 minutes later, a couple of cops did show up, and weirdly, the guy kinda calmed down when they did. They cuffed him and took him away, and then we did reports, and like an hour later, I was able to finally drive her home. But she said the guy just wanted drugs, and she saw that a lot. I still thought it was crazy he couldn't walk. Next story. Student nurse, but this happened when I was at the gym. Guy next to me fell off the elliptical, somehow got his foot trapped between the foot pedals and went sideways. The surprisingly inept PTs, personal trainers, are usually well trained in first aid, were freaking out, and this guy is really hamming it up. Talks of calling an ambulance are thrown about, and I offer to step in. Ah, my ankle! He's on the floor grabbing his leg, and I kneel next to him. Hey bro, I greet him. He's so surprised that I'm there. Came up from behind, that he forgets to groan. How much does it hurt on a scale of 1 to 10? 8, he says. I look at his ankle. There's a scratch on it the size of a penny, and superficial, hardly any blood. Little red around the scratch, ankle not swollen. I ask him if he can point and flex his foot and rotate his ankle, which he can do with zero difficulty, not even a grimace. I figure he's probably hamming it up because it's embarrassing falling off a machine in front of people, so I get him an ice pack, mostly for show to be honest. Tell him he'll be fine, and tell the PTs not to call the ambulance. His sister comes to pick him up in her car, and he limps out on the wrong leg. Yeah, you had the charade, you had it. Down pat didn't fool OP, of course, but man, hopping out on the wrong leg, like you gotta at least know where to focus that phantom pain, right? Next story. Not a doctor, but I have a story. My son's uncle was pretty much bedbound. To go to the toilet, he had to use a walker, and it would take him about 10 minutes to slowly get himself to a toilet at the back of the house. He had the whole family waiting on him hand and foot for years. We were visiting once, and my son, a baby at the time, fell asleep in the lounge. I didn't want to move him, so I stayed behind reading a book while the rest of the family went out. The house was really quiet, and I heard Uncle get up and watched him march past me with no walker and no mobility issues. He certainly jumped a foot in the air when I said hi, and his face was a picture. Next story. My wife's a district nurse. She drives to people's homes, changing dressings, giving medications, etc., etc. Her job has her dealing with many people, such as gang members and people on home detention. But the worst, in her opinion, the people you never trust even a little bit, are the Methadone patients. According to her, a lot of them will try anything to get a little bit more. She had one not long ago that was being extremely talkative, almost like he didn't want her to leave the house. Then he started showing her every little lump and bump, wanting her to make sure they weren't infections or anything. Although he wasn't making her uncomfortable, she did think it was strange for him, as he was normally very quiet and wanted the nurses gone ASAP. When she got back to her car, the back window had been smashed in, but all that was missing was her sharps container and the lockbox the drugs were kept in. Didn't take a genius to figure out what was going on, so she walks back to the house, looks in the front window, and sees the Methadone dude and another guy sitting on the couch trying to open her lockbox and emptying the sharps container on the floor. She called the police at that point, and despite knowing that some of the needles now on the floor were from an HIV plus patient she had earlier in the day, she sat in the car until the PD arrived, because you never, ever get between a junkie and a fix. Next story. A lot of people faking pain for medication. It was obvious they were lying, since they were clearly making up the story on the spot, and it wouldn't be consistent, then they would always sneak in the, "So that can get me more codeine, right?" Had one lady tell the doctor that her ex, gave us his name and picture, would lie for medication and sell it on the street. Not sure what the doctor did in that one. Had a kid lie about being sick, and his mom took him to call his bluff and asked for like 20 shots for him. He started crying and told the truth, and I'm sure he got the spanking of his life. That was fun to play along with, though. Next story. Had an employee that was allergic to everything and a huge hypochondriac. She was such a headache that we ended up moving her desk way away from pretty much anyone else so she would stop complaining. One day, a lady walks by with a strong perfume, and our lovable hypochondriac falls out. Predictably, EMS is called. And by this point, our employee is laying on the ground, rolling her eyes back in her head. Scary stuff if you didn't know she was literally insane. So EMS arrives and they come over, put the O2 meter on her finger. She's choking through her speech, and when they're asking her if she can breathe or not, O2 saturation was at like 97% or something like that. Medic goes, "Ma'am, there's no reason why you should be having trouble breathing right now." They hung around for another couple minutes, then bounced. Next story. ER nurse here. Not a faking it story, but this is my all-time favorite story of patient stupidity. I had a female patient in her 20s come in, accompanied by her boyfriend with complaints of abdominal pain. One of the first questions we ask women of childbearing age is if there's any chance they could be pregnant. This girl said there's no way she could be pregnant. I asked her if she was sexually active, and she said yes. When I asked if she used birth control, she said, "Well, I used to, but they made me fat, so I gave them to him to take." Turns out, this girl had been giving her boyfriend her birth controls to take, and sure enough, she was pregnant. Okay, I may be aloof here, but how does that work? If a guy takes birth control, nothing happens, right? Right? Not to the guy, at least. Next story. A quick note of being on the other end. I have multiple sclerosis, but my original symptoms were non-typical, so they sent me to Stanford to be evaluated. It was very strange to see one doctor turn to another and say that their diagnosis was that I was faking it. All of my symptoms were numbness, itchiness, or weird tension on my skin, so I had no way to prove it. Luckily, one of my eyes had an enlarged optic nerve, and when they did a test of my spinal fluid, they found white blood cells in there. But I think of that all the time. That doctor was right. My symptoms were kinda crazy. I'm glad they found some real evidence. By the way, doing great. Symptom-free and taking a daily injection of copazone to keep it away. Next story. As a nurse and as someone who's had a seizure, I wonder about all the fakers who pretend to seize. First, pretending to have a seizure, well, is hard to do. Second, they forget what certain types of seizure cause you to piss yourself or bite your tongue, or even worse, the horrific sounds people can make when they seize. My advice, fake something easier than a seizure because you're unlikely to convince me. And even if you do, a neurologist with an EEG will figure out that they aren't true seizures eventually. Although I did have one patient who would have pseudo-seizures that broke her nose falling on the floor. That was pretty impressive. Next story. Had a patient fake Guillain-Barré syndrome, ascending paralysis. She ended up in the ICU, and I was her nurse. I was a new grad and had put a catheter in her bladder. She had pretended that she couldn't feel a thing, and I could see the pain in her eyes. Turned out she got into a fight with her husband, and as he was walking out of the house, she fell on the floor to make him stay. I don't think she meant to take it so far, but she didn't know how to back out. Another ICU PT. She was a nurse on disability and would fake seizures, which are really hard to fake. She would hold her breath and shake and roll around on the bed. Her O2 saturation dropped to the 70s from not breathing, and maybe the sensor wasn't picking it up as well as she was shaking. And we told her we'd intubate her if she couldn't protect her airway, and she would miraculously stop seizing. Never acted postural and couldn't remember the whole seizure and everything that was said. She told me she would call my manager since I said during one of her seizures we didn't need to give her Ativan. Next story. In EMS, I see fake seizures fairly often. They're hilarious. The best bit is when they keep convulsing while you prepare to give them an IV. But as soon as you go to poke them, they seem to magically keep the IV arm still while the rest of their body shakes about. Usually my response is along the lines of, "Hey, will you quit it already?" Next story. Had a mother come in and insist that her child had Silver Russell syndrome. You can go read on it. It's not that easy to fake, as it's a bunch of metabolic conditions mixed with congenital abnormalities. The kid was small, but not that small, around 6th percentile. He didn't weigh much, 5th percentile, and all of this with a right arm length 2 centimeters more than the left side, were borderline criteria for Silver Russell. Did genetic testing, which came back negative, but 30% of cases are negative. So the deciding factor was one of the soft criteria of hypoglycemia. Once she heard about this, she printed out 30 to 40 articles on the disease. She came back with the kid in a coma, but when the kid was in the hospital, he was never hypoglycemic. He went home and came back in a coma a few weeks later. Again, as soon as he was eating normally at the hospital, he was never hypoglycemic. She starved her child into comas repeatedly for the diagnosis of Silver Russell. She was also a boujon, people who live off welfare and make a game out of it. By the way, she was in a wheelchair when at the hospital. Once I had enough of her bullcrap and walked into the room after only knocking once. She was walking around normally and jumped into the wheelchair as soon as she saw me. I believe it was for money, since in Canada and Quebec, you get money when your child has a genetic disability. God, if it was legal, I would have slapped some sense into that female dog. Next story. Obligatory, not a doctor, but my mate lives opposite a guy who claims disability benefit. Has a subsidized car, disabled parking permit, walks with a crutch, the whole thing. Last summer, he landscaped his garden and had 12 railway sleepers delivered in front of his house. We watched as he and his son manhandled all the sleepers up onto their shoulders and walked them through to the back. Moving one would kill me. Later, he walked out carrying his crutch, got in his car, and went shopping. Next story. As a resident, I had a patient who had a blood clotting disorder, but also who was addicted to IV pain meds. He figured out how to get admitted for an extensive workup for possible blood clot in the lung and IV pain meds for his chest pain. He came in all the time, but it was very difficult to block the admission because he actually did have a risk of this problem. Never took his blood thinner correctly, and his symptoms always brought him a couple days at least while we ruled out a clot and got his blood levels where they were supposed to be. But it meant he had accumulated over 30 high-resolution CT scans of the chest over his life as part of the workup, which is not good for you. I had this one question I would ask people who tended to come in complaining of every serious-sounding symptom they could think of. Does it ever hurt behind your eyes when you pee? I was very salty at that point, and this guy was a nightmare when he ended up on your service. And it really bothered me that this guy was buying himself a lung tumor with all those PE protocols just to get a day's worth of IV pain meds and Benadryl. With him, I started asking the pain behind your eyes when you pee question like it was extremely important, and quickly he started answering yes. And I acted like it was an extremely serious condition that warranted evaluation. Once it was clear I couldn't avoid the admission anyway, I considered one of my greatest achievements in residency that he one day showed up in the ER with pain behind my eyes when I pee as his chief complaint. I heard a colleague talking about this crazy dude who came in demanding to be admitted because he had excruciating urination-related eye pain. Made my day. Next story. EMT here. The one that sticks out is the most textbook example of drug-seeking behavior. Get called out to your residence at 2 a.m. because, of course, it's always 2 a.m. Guy says he's having 10 out of 10 finger pain and gingerly holding his hand in the air. Says there was no trauma, just started suddenly and it's unbearable. So we load him up, take him the 25 minutes to the hospital. Entire time he's holding his hand in the air, but we had a full conversation, talked about football. Never once did he complain about pain. We wheel him into the ER and literally the second we walk through the door, this guy starts writhing in pain. Says he can't sit still and the pain is unbearable. He has to stand up, screaming at the nurse to help. Then he turned to the nurse and said, "I had this same issue at a different hospital 2 weeks ago. They couldn't tell what was wrong. They gave me morphine, but that didn't work, so then they gave me Dilaudid. That worked. So maybe you should just start with Dilaudid tonight." And then he went back to moaning in pain. Nurse and I just looked at each other. We put him in a bed, and I drove the 35 minutes back to the station. Highly doubt he was given any pain less that night. Was just a colossal waste of everyone's time. Next story. Okay, for everyone complaining about nurses and doctors being skeptical about your legitimate pain and not handing out narcotics as readily as you would like, narcotic painkillers are effing evil. I've been a nurse for 6 years. The drug companies have paid for research to straight up lie to the public about how incredibly addictive opiates are. They're not safe. They're not appropriate for your toothache or your cramps or your sore back. Thousands of people die every year from opiate overdoses, and the drug companies become richer and richer. You think you have a right to strong painkillers because you've been lied to. I take care of people every goddamn day who are addicted to opiates, and don't think for a minute that you're better than them. They were just like you once. They were irresponsibly given strong drugs and told they were safe, and they took those drugs home and took far too much of them for far too long, because they trust their doctor and the medical system. Narcotics are great for truly severe pain in an acute care setting and for those with chronic, end-of-life illnesses. Used incorrectly, these drugs ruin lives. TLDR, you can't trust Big Pharma and the doctors who are under their thumb. Only take narcotics for pain that literally makes you scream, and stop taking it as soon as possible. Next story. When I was about 7 or 8, my older sister found out she needed glasses. My parents and sister kept talking about how detailed the leaves on trees looked after getting glasses, and before it just looked like a green blur. Well, I wanted to be cool and get glasses too, so I peeked up and said, "That leaves in the trees just look like a blur to me." Flash forward to the eye clinic. There I am being asked to read the eye chart by the eye doctor, who was a family friend. I knew if I read it accurately, they would know I didn't need glasses, so I lied trying to fudge the results as the doc kept flipping different lenses. Finally, he flips to one and says, "This one should work for you." I read the whole chart, and immediately after, he sticks a pen right through where the lenses should be. I was super humiliated, and the doctor just laughed, but my mom was pissed. I was a lying little bastard, and I got it good from Dad that evening. Next story. Not a doctor. I was in the ER for a broken ankle in college, and where I was at, Tampa, had a fair bit of homeless people. One guy came in complaining of terrible chest pain and couldn't breathe other than random symptoms. This guy is obviously homeless. The nurse asks for a urine sample. He says he can't. She says they'll need to put a catheter in. He freaks out, saying it's not necessary, and says all he needs is medicine and food. And of course, the only medicine that works for all his symptoms is oxycodone or Percocets. From what I gathered in a dilated-induced haze, they did some basic tests, and he miraculously felt better when they weren't giving him meds. It really irked me because I was waiting on that doctor to reset my ankle, which was 90 degrees sideways. Next story. We had a lady when I was in nursing school who had been in the hospital a multitude of times for various actual neurological conditions. On top of this, she had a borderline personality disorder and was extremely manipulative. She had a full neuro exam on so many occasions she could actually mimic a problematic exam and make you believe that she was having a stroke or some other issue. Problem was, on an occasion I witnessed, she'd forget to be consistent with the side that she was feigning weakness or paralysis on. So she'd sit, only move one side of her face, one side of her body, talk funny because she would only move one side of her mouth, since the other was paralyzed, etc., but then she would forget to move a finger or something on the side that was supposed to be paralyzed. Next story. We had a teenager admitted with unexplained seizure activity. Her mom and boyfriend were beyond concerned and stayed at her bedside. How she was even admitted in the first place is a mystery. Anyway, she started seizing and her family called a rapid response. Basically, it's an emergency, but not a code blue. The rapid team responds and the on-call physician was a delightful a-hole. The situation was explained as we're going down the hall and he says, "Someone just give me a flush." We get in the room and he says in a soothing tone, "It's okay, Jane. I'm going to give you some medicine to help. It should work pretty quickly." That saline quelled her seizure pretty much immediately. Next story. Pharmacist here. When I was interning at Rite Aid, there was a patient that came up to me and insisted that they needed their ADHD medications right now because the pain was unbearable. I was out of stock and she spent a solid 10 minutes standing in front of us complaining while we tried to give her back her prescription so she could go somewhere else. Even when we asked, she never told us what pain she had. Next story. I was an intern in a busy trauma ED when a guy walks up the ambulance bay and screams he needs to be seen immediately. They take him back and he starts telling everyone he was in a car accident last night going 100 plus mph on the interstate, but did not go to the hospital because he was worried about his friend, the driver. But now he's losing feeling in his legs and has severe back pain and needs to be seen. So of course, the story is super fishy, but we put him on a backboard/collar and get some x-rays of chest and pelvis, our protocol for any severe trauma. The radiologist who's stationed in the ED flags me and asks when our patient got a CT scan. He showed me his pelvis x-ray and his bladder is super bright. It's filled with iodine contrast agent they inject in your veins when you get a CT, which is then excreted by the kidneys over the next few hours. So we confront our patient about why he didn't tell us about being seen at another hospital and getting a CT. He launches into a rambling explanation about concussions and amnesia. He has, of course, also exhibited several other drug-seeking behaviors in a short time in the ED. He decides to leave AMA, but not before asking the nurse directions to the nearest hospital, presumably to try the same trick. Next story. My mother was the school nurse when I was in high school, but she's been a nurse my whole life. She's told me a few good stories, obviously without names, but I was lucky enough to overhear one of the students trying to fake an illness to get out of class. The kid, we'll call him Derek, was a scud. White trash, moody, and destructive. Not my favorite classmate, but I was laying there when I heard him come in and start his routine of attention-seeking. Mom used to let me skip seminary and nap on the empty beds. So my mom runs through all the basics, temp, blood pressure, etc. Well, Derek finally just cuts to the chase, obviously frustrated with the procedure. "Look, Mrs. S, something is seriously wrong here and I'm not faking it this time," he screeched, defenses already 10 feet high. "Okay, Derek, what's the problem this time?" she asked. "Well, earlier this morning I started feeling sick, so I went to the bathroom to throw up. After I was done, I looked at the toilet." Dramatic pause. "And there were over a dozen whole baby carrots." Another pause. This one I think was for any gasps that might be coming. "And I don't even eat carrots," he nearly shouted. Well, after about a 10-second pause, and what I'm guessing was the hardest straight face my mother ever had to keep, she said, still fighting back laughter, "Well, Derek, your body is producing carrots at an alarming rate. Weird that it only seems to happen during gym, though. Here's a Gatorade and a hall pass and get back to class. See you tomorrow, Derek." He left, stunned to be written off so easily, and we had a good old laugh. And "I don't even eat carrots" has become a family favorite catchphrase. Next story. I work in a psychiatrist's office, curious how many people lose their prescriptions, or even their whole bottles of Adderall, Valium, etc. We've heard some good ones. Lots of them lose their bottles by dropping them into the toilet. One guy told that story, and the very next week, the RX apparently flew out of his convertible on the highway. LOL. We now tell all patients, especially college-age patients, that they need a police report stating that their meds were stolen to get a refill if it's too early. It's always the same people who do this, time after time. Next story. My SO is a dentist. I've learned that if it's a new patient coming in, she rarely prescribes pain medication. Far too often, if she does, she'll never see that patient again. She'll just go to a different dentist for the next time they want more. She'll typically tell them to take ibuprofen. They usually scoff at her, but she's right. Ibuprofen is adequate for the vast majority of pain afflictions someone might have, dental-wise. Another topic is how many people want an antibiotic prescribed when it's absolutely unnecessary. The vast majority of her patients don't understand the state of antibiotics and the effects they have. Edit. I should have been more clear. When I say afflictions, I refer to a toothache and the like. Having, say, a root canal or extraction is a different case. She just tells me that when somebody is in her office as a new patient complaining of pain, more often than not, whatever it is they're complaining about can be treated with normal painkillers. Next story. Another paramedic piping in. One day I went out to a no-tell motel at about 3:30 p.m. for seizures. When we got there, about 25-year-old guy was sitting on the bed. His girlfriend describes his whole body shaking. "It stopped just before you got here." He's completely alert and oriented. People who have seizures generally take a while to wake up. And they describe a vague seizure history, no diagnosis or meds, and he hands me his driver's license for ID. If you have a legit seizure, the first thing they do is take your driver's license away. We finally walk him out to the ambulance, and the girlfriend asks if she can come too. I tell her of course, and the real reason comes out. Apparently, she's on a pass from the same hospital we're transporting to and has to be back by 4 p.m. There's only one unit that does passes like that. Psychiatry. Next story. TLDR. Patient fakes respiratory distress for pain meds, shoots up heroin. Significant other wrecks a car. New green nurse almost craps his pants at work. Oh, I have several of these. I'm a nurse. Previously, I was on a general medicine floor for the layman, med-surg for the people with the know. I distinctly remember this case and probably will forever. I was a green nurse, fresh out of school. I was working night shift, and this particular patient was probably 400 pounds. Had a history of several lung diseases, diabetic, probably a few other chronic illnesses. Anyway, this guy just wanted some pain meds. Of course, I'm only authorized to give her a few per day with the doctor's orders. He would get all fired up and enter coughing fits because I wouldn't dose him with any more pain medicine, which isn't the treatment for what he had going on anyway. The patient's significant other is also in the room. My shift was going quite slow. It was probably around 2 to 3 a.m. when the incident occurred. I was walking down the hall to do my rounds when I heard a very distinct noise. Anyone will recognize it immediately that something is terribly wrong. Those in medicine call it stridor. It's a sound that one makes when the airway is obstructed. It's a very high-pitched sound. I started sprinting down the hallway since I anticipated an emergency, since a new onset of stridor is pretty ominous. I enter the room and the patient is grasping at his throat. His significant other is freaking the hell out, and I yell for help. As people are converging on the room, I check his mouth for obstruction. The significant other tells me he just sat up and started making that sound. Then I didn't have an oxygen probe on me to check the O2 saturation of the patient. I carry one on me at all times now, so I grabbed the oxygen mask and cranked it up while the rapid team was arriving. In hospitals, there's sometimes a special unit called the Rapid Response Team that has nurses with advanced privileges to make quick orders. A respiratory therapist nearby responded and said that she had given the patient a breathing treatment a few minutes ago. She came in and started another treatment of albuterol on him. Within seconds, the stridor resolved. with albuterol. It was at that moment I knew I had been played. Albuterol doesn't resolve stridor. If anything, steroids will. It was a miraculous turnaround. The patient was like, I feel better, but my chest hurts now. Can I have pain medication? The patient faked stridor to get pain meds. I, of course, told him that he couldn't have any since he was already at the limit for the day. For those that don't know, too much opiate can depress your respiratory drive to the point that you stop breathing and die. He had extensive lung problems, so depression could kill him easily. The night calmed down. An hour or so later, I check in on him and he zonked the F out. I can't wake him up. He's not responding to pain, commands, anything. I call Rapid again. The significant other rolls over on the couch and had a bag of drugs in their hand that I can only think was heroin. I suspected that they shot up in the room and now the patient is compromised. I put him on O2 and call the rapid response team and tell them to bring Narcan. It reverses opiates. The patient turns out all right, but in the confusion, the significant other stumbles off the unit, makes it to the car, and drives a few blocks before wrecking into a ditch, where they were retrieved and taken into custody. Luckily, no one was injured.